can either record. Thank you.
Yep, I gave you permission. I don't know what's up with Zoom with this. This is the first time I've ever had these problems.
Me too.
But technology, right?
hmm We
Sure,
make it
why
work.
not? I would ask if everyone could mute themselves except the people who are speaking. That would be really helpful. Thank you all so much. Glad you're here.
Thanks, folks. We'll go ahead and get started. And I want to echo Jen's sentiment as well. Good morning. Welcome to today's presentation. So wonderful seeing all of you and your smiling faces here today, and hope that you all are enjoying a lovely early fall day here from wherever you're calling in. And again, I'm looking at the chat here and seeing so many amazing organizations represented today. From wherever you're calling in, welcome. My name is Kalani Makanui, and I use he, him pronouns. And I am the Clinical Supervision Programs Coordinator on the Behavioral Health Workforce Incentives team here. Sorry, hopefully, can folks give me a thumbs up if you can still hear me? Fantastic. Thank you so much. Again, I'm the Clinical Supervision Programs Coordinator here with the Behavioral Health Workforce Incentives team here at the Oregon Health Authority. And we're so excited to be able to share a funding opportunity here that is near and dear to us and the Behavioral Health Workforce Incentives team. And at some point in future info sessions, you'll be meeting other members of the House Bill 2024 grant administration team. But it's, of course, an honor for me to be able to kick off our first informational session in this series of three, or two or three, possibly three, here in community with you all here today. Next slide, please. I want to take a moment to walk through our ambitious agenda today, which is admittedly very informational heavy, but luckily we will offer again, another couple of webinars that will cover other various parts of the application and the grant rollout and implementation process. And we will also make the recording available after the conclusion of today's webinar. And so as a bit of housekeeping, if you or anyone on the call, as we proceed through the slides, have any questions, comments, please feel free to drop those into the chat. We will, of course, be compiling all of those amazing questions and turning those questions into a frequently asked questions document that we will hereafter be making available on the HB 2024 webpage. And so, of course, we will provide the URL to the House Bill 2024 webpage after today's presentation, and you'll find up-to-date information on that webpage. You can also, in session here, raise your hand, and I will be sure to call on you to ask your question or present your question to the group. Additionally, we'll have time at the very end of today's presentation to answer any lingering questions that folks might have. If you would, please, if I could get somebody from our wonderful OHA team to let me know if there are any questions in the chat or respond to any questions in chat, as I'm not able to monitor that as I go along. But next slide, please. So as many on this call are intimately familiar with and acquainted with, we in Oregon are currently experiencing a behavioral health workforce shortage, and a substantial shortage.
Kalani, excuse my interruption, but there are no slides showing, at least on my end of it.
I can see slides here.
I can see
slides.
Okay.
I do as well.
All right.
Yeah, I do too.
My apologies then for the interruption.
Not at all, Karen. Thank you. And again, if there are any slide challenges or audio challenges, please jump in and let me know. So I don't give this whole presentation without folks being able to see. So, and of course, we'll make these slides available after the presentation. And of course, as many on the call are quite familiar, Oregon is currently experiencing a behavioral health crisis, making it very, very difficult for many Oregonians to access mental health and substance use treatment. These challenges are especially severe and pronounced for individuals from historically marginalized communities and those who are most affected by health inequities. According to a recent report that was published by Mental Health America earlier this year, Oregon ranked 42nd amongst other states in a system that they developed, a ranking system aggregating 17 different metrics of mental health and wellness indicators. So these included things like access to mental health, substance use services for both adults and youth, availability of insurance and underinsurance, mental health workforce availability, which House Bill 2024 and numerous other legislative actions have addressed over the course of the past couple years, or a few years, and presence of unmet mental health need amongst Oregonians. However, and promisingly, Oregon remains steadfast in its commitment to closing those gaps that have identified in behavioral health care, and has really reaffirmed its commitment to all Oregonians having the opportunity for access to necessary services. This includes meeting behavioral health needs necessary to ensure vibrant and thriving communities. And of course, keeping with that commitment, it's important to ensure that the distribution and the capabilities of our behavioral health workforce adequately serve the needs of all Oregonians, and that workforce is reflective of the specific needs of communities being served, and that our behavioral health workforce and our professionals are working in a manner that is supportive, culturally and linguistically responsive to promote the well-being of all Oregonians. Next slide, please. And so as you can see here from this slide, the map was taken recently from the Oregon Behavioral Health Talent Assessment that came out earlier this year, and really underscores the extent and severity of the critical shortage of mental health providers in Oregon's, particularly in Oregon's rural and frontier counties. With 32 of the 36 counties lacking even one provider per 1,000 residents. And so, as you can see here, the graded sort of green here represents density in terms of mental health providers per 1,000 residents across different counties. And as you can see, more than, or what was noted in that report was that 1.5 million Oregonians live in a community that does not currently have enough mental health professionals. And this was also echoed in a report by the National Alliance for Mental Illness, or NAMI, in 2021. And one of the key challenges is that there are, of course, not enough behavioral health providers to staff all of these areas, particularly in rural areas, and especially within key areas and with the specific training, talent, skills necessary to address current emotional and behavioral health needs, which we see have been increasing steadily since the pandemic. According to the Health Resources and Services Administration, or HRSA, in their recent National Center for Health Workforce Analysis, there's a projected shortage across behavioral health occupations, which include addiction counselors, mental health counselors, psychologists, social workers, marriage and family counselors, and particularly school counselors that are based on current unmet need. And so these trends in Oregon aren't necessarily specific to Oregon. They actually mirror a trend that's occurring nationally, where the behavioral health system has been overall faced with shortages, while concurrently demonstrating a lack of racial and ethnic diversity in providers, as well as uneven distribution across and within states of behavioral health providers. And so here within Oregon, one of the most substantial service gaps that exist are for culturally and linguistically specific service providers. In the most recent Oregon Healthcare Workforce Needs Assessment, Latina providers specifically were noted as underrepresented in all licensed behavioral health professions across the state, despite Oregon's Latina population representing one of the largest segments of unmet mental health need, and of course experiencing substantial and persistent barriers to service access. And so this map really does provide a glaring visual of the extent of the provider shortage across Oregon. Next slide, please. And of course, more statistics that amidst this behavioral health provider shortage, behavioral health needs also remain high and are increasing, especially following since the pandemic. And just some statistics here that almost 300,000 adults in Oregon did not receive needed mental health or behavioral health care in the past year, many because of either cost or provider access issues. And the challenges are especially pronounced for youth, whereas 12 to 17% or 12 to 17 years, 55% of those youth who experienced things like depression last year did not receive needed care. And as we know from youth outcomes, um, this is a particularly important time for youth, given that this is when mental health conditions are first diagnosed and when first present and can substantially worsen over the course of the adolescent years as they progress. Depending on if you look at the glass is half full or half empty, in a recent report from Mental Health America, Oregon was ranked 42nd out of the states along that index that I mentioned before of 17 different health-related metrics, which included prevalence of disorders, prevalence of substance use, unmet mental health need, workforce access and access to services and insurance coverage. Other estimates had noted us at 49th that I read a couple years back. And so we are, of course, moving up the rankings or moving up the ladder, which is promising, but as we note here, we still have a long way to go in terms of closing those gaps in service access for current mental health and substance use concerns statewide. Next slide, please. And so in 2019, as many of you are well aware, Oregon Health Authority became the first health agency in the country to declare an ambitious statewide goal to eliminate health inequities and to do so with an ambitious timeline of 2030. And Oregon Health Authority set forth that ambitious strategic plan to meet the goal by identifying 5 distinct pillars necessary to support this ambitious effort. So especially relevant to today's presentation are the goals that were envisioned within pillar number 1 here on the diagram, which include transforming the behavioral health system. And within that vision, and guided by persons with lived experience and in community with invested partners and various communities across the state, it was noted that OHA would build a health system that works for every child, every teen, adult, and family experiencing a mental health or substance use issue, thus ensuring that Oregonians can reach their full health potential and well-being. It was also noted within that vision that there would be an expansion and an integration and coordination of culturally responsive behavioral health services, serving individuals, families, and communities when and where people needed them, such that Oregonians would not face disadvantages due to race, due to ethnicity, due to language, due to disability or immigration status, or age or gender identity, or any variation of intersectionality therein. And so health inequities, of course, are identified as those unfair differences in health care access between groups of people. And those differences, of course, based on social, economic, or other factors, such as racism and other forms of bias or discrimination or oppression. Of course, research has shown us that those inequities can cause higher rates of health problems in communities, including a wide swath of outcomes, including infant death, chronic illness, short lifespan, decreased quality of life across different groups. And so key actions that were identified within that first pillar of Oregon's ambitious strategic plan included building the behavioral health workforce to serve all people, particularly those who experience those health inequalities or inequities, expanding access to community-based services, things just like peer respite houses, online support groups, drop-in centers, bolstered supports for children and youth, particularly in schools where mental health services and behavioral health services are sorely needed, and other innovative approaches. And of course, expanding the availability and funding for an array of preventative behavioral health services, especially for youth and families in early childhood. Next slide, please. And of course, to get to the reason for the season and why we're all here today on this informational webinar, we on the Behavioral Health Workforce Incentives team are very excited to introduce and discuss House Bill 2024, which is, of course, lockstep and well aligned with OHA's strategic plan to transform behavioral health systems and services, to strengthen access to care, and to foster healthy and vibrant communities. And of course, all in the service of eliminating health inequities for all Oregonians by 2023. And so House Bill 2024 is specifically addressing the issue of workforce shortage and directs the Oregon Health Authority to award educational grants to eligible entities, which we'll discuss a little bit later in this presentation, to support the recruitment and the retention of behavioral health care providers specifically. And this solicitation through House Bill 2024 aims to provide educational incentives to qualifying behavioral health entities to support, sustain, and grow this workforce and address this workforce shortage so that they can be more equipped to expand services and increase delivery of quality care to all Oregonians consistent with OHA strategic plan. Next slide, please. And of course, the behavioral health care means services and supports for individuals who have mental health disorders or substance use disorders, of which we know there is a high concurrence of comorbidity. And the Oregon Health Authority shall, of course, under House Bill 2024, establish a program to award grants to eligible entities. And the grants awarded under this section must be used, of course, specifically to foster the recruitment and retention of behavioral health care providers at eligible entities. Next slide, please. And so the program goals for House Bill 2024 are specifically intended to improve the recruitment and retention of behavioral health care providers, especially those identified in rural, frontier, and other high-need areas across the state. Also to increase the number of individuals training for and entering the behavioral health workforce. So you will see when we talk about the appropriate use of funds here in subsequent slides, that some of those incentives are earmarked toward training for those entering the behavioral health workforce at the undergraduate level or graduate level. To also increase and expand service capacity and capabilities for those rural and underserved communities, which will also provide some more specific definitions for as we progress in the presentation. Supporting career advancement opportunities for behavioral health care providers through education and training. And you'll see that some of these incentives will also include training certification for certified workforce as well. Increasing the behavioral health system's capacity to provide culturally responsive care that is, of course, deeply embedded in equity-centered and culturally responsive practices, destigmatizing services and promoting restorative healing and community empowerment practices with funds. Next slide, please. And so to detail some of the entities that are eligible to apply, I know that we have received questions thus far in the HB 2024 inbox about whether entities are eligible. We are always open to field those questions as well, but did want to just present the eligibility criteria here. So the following entities are eligible to apply. Entities that have a certificate of approval or a COA, entities that offer medication-assisted treatment services or MAT services, entities that are contracted with Oregon Youth Authority or OIA, entities that are certified opioid treatment programs, and entities that provide withdrawal management services. So out of those eligible entities, we also have additional criteria that are listed here on the next slide. And all eligible entities, as noted within the HB 2024 bill, must operate an outpatient or residential facility that provides team-based care to individuals with acute behavioral health needs. And we'll discuss on the next slide here in just a second what some definitions around team-based care. And also provide behavioral health care to adults or youth, of which at least 50% are uninsured or enrolled in the state medical assistance program, OHP, or Medicare. Next slide, please. And to qualify as a team-based high acuity Medicaid provider, as identified on the previous slide, a behavioral health provider must meet one of the following. So either column A or column B. So OHA anticipates issuing more detailed guidance in November, and we will, of course, post this guideline that's been issued through OHA to our materials and your website as well as they are released. But either A, be a community mental health program offering one or more of the following. So assertive community treatment or ACT, ESA, early assessment and support alliance services, or intensive in-home behavioral health treatment. So category A there, or meet all of the following under category B. Holding a certificate of approval from OHA, deriving at least 50% of annual behavioral health revenue from services to OHP members, and providing integrated team-based care that includes any combination of on-staff psychiatric providers, integrated peer support, case management services, or individual, family, group, and community-based services as clinically indicated. Next slide, please. And of course, who is eligible for funds? Now, the way that the bill is set up, funds are distributed to organizations who then distribute funds to the qualified recipients of funds within those organizations. So this is a list of eligible recipients of funds. So certified drug and alcohol counselors, or CADACs, certified gambling addiction counselors. We have a slew of direct service providers here like social workers, MFTs, professional counselors, psychologists. Within the certified workforce, we have or designations like qualified mental health associates and professionals. That extends also to speech pathologists, those who provide medical treatment or services to clients in the service of behavioral health care, such as psychiatric nurse practitioners and psychiatrists. And you'll see just a list of other folks here. Also, peer-based services as well. So peer support specialists, peer wellness specialists, community health workers. And you'll note here on the column on the right that this could include other credential types that are not listed necessarily within the scope of the bill, but that do provide direct behavioral health care services using their credentials, and that also require clinical supervision to obtain credentials. And importantly, staff who do not currently provide direct behavioral health care services may also qualify for educational incentives if those incentives support them obtaining certification or licensure that do provide direct behavioral health care services. So some of those additional certifications like substance or certified drug and alcohol counseling, or some of those certifications that can be obtained in service of direct behavioral health services. Next slide, please. And so use of funds. Funds may be used to provide the following incentives to increase the recruitment and retention of behavioral health care providers at the entity. So scholarships. So scholarships for undergraduate and graduate students going into the behavioral health care field. Loan forgiveness and repayment incentives. Tuition assistance. And stipends for students enrolled in graduate behavioral health care education programs. Next slide, please. Grant funds may also be used for the following allowable activities and expenses. Educational incentives for eligible behavioral health providers, including scholarships for undergraduate or graduate level education, tuition assistance for degree completion or credential advancement, stipends for students enrolled in behavioral health graduate programs, loan repayment or forgiveness in exchange for a service commitment, academic materials directly related to the provider's program of study. So, for example, required books, testing fees, licensure application costs, and up to a 12% of administrative staffing fee necessary to manage and implement the incentive programs. So the administrative the portion of this is not to exceed 12%.
Hey, Kalani,
Yes, please.
we have 3 questions in the chat. The first one is, can you define integrated peer supports? Does that mean we directly hire people for peer supports and they are on staff currently?
Excellent question. I have others here on from OHA. Can somebody jump into field that? I see you take yourself off of mute, Tim.
Yeah. No, that's a great question. Let's save these questions for the Q&A section. We'll get to all those written questions there, and I see some more coming in, but yeah, feel free to put them in now if you have them. But yeah, Kalani, I'll just let you continue and we'll run through those questions once we get to that Q&A section.
Thank you so much, Tim. I appreciate it. And again, keep those coming. We will definitely come back to those. And if we could have our wonderful team here at OHA just sort of keep an eye on those to make sure that we flag all those in Q&A. Next slide, please. And of course, we wanted to cover those aspects that may not be funded under the current funding, since there are some restrictions. So grant funds may not be used for services or activities unrelated to behavioral health education, training, or credentialing. May not be used for salaries or wages for non-administrative staff who are not directly involved in grant implementation. Cannot, of course, be used for capital expenses, including construction or renovation of facilities. Indirect costs exceeding the 12% administrative cap. Incentives or payments for non-licensed and credentialed staff without a clear pathway to certification or licensure in behavioral health. And reimbursement for expenses incurred prior to the grant award date. And of course, in the service of full transparency, we wanted to make sure that we, mentioned and will continue to mention throughout that all eligible incentives provided through this grant may be considered taxable income for the person receiving them. And so this means that the individual might owe taxes on funds dispersed. And so, of course, awarded entities should check with a tax professional to understand any potential impacts prior to giving out incentive funds, and should clearly explain any possible tax implications to providers before awards are made. OHA, of course, is not responsible in providing tax advice or determining tax obligations. So we very, very much encourage folks who are interested in pursuing grants or under House Bill 2024 to ensure that the recipients know of the tax implications of receiving funds. Next slide, please. And with the funds do come some reporting requirements. And this is, of course, in the interest of accountability for funds. We always want to make sure that funds being distributed through programs show tangible outcomes, and that we're able to be transparent in the public about what funds are used for and the tangible outcomes associated with funds. So recipient organizations will be required to report in a manner that's determined by OHA, which will likely include things like the licensure and certification or position type of each behavioral health care provider, so we are able to track and demonstrate where specific incentives were deployed to. The amount of grant money spent per behavioral health care provider, the entity's staffing vacancy rate prior to and after receiving the grant. So we were able to look at whether funds truly are making an impact in terms of recruitment or retention of behavioral health workforce within organizations. And typically quarterly and or mid-project and closeout reports. So whether this isn't quite defined yet, but typically it ranges either from quarterly to mid-report, and there is usually a annual or year-end report demonstrating how funds were spent in some of these indicators herein. And additional reporting may be required based on the specific workforce incentives awarded and utilized by participating entities. And in prescribing the form and manner of the report in the subsection, we'll seek to, of course, minimize administrative burden. We know that administrative burden is real, and that there exists many, many tasks that you all are required to report on. So we do, of course, understand what agencies are under in terms of reporting requirements. And that's why we did include those administrative funds within the deployment of this grant incentive. But we will try to keep them reasonable. We understand how much effort and how much organizations have to juggle in terms of burden. Next slide, please. And so I do want to place the caveat here as we discuss the application timeline. So this is, of course, tentative and subject to change. The research for funding grant awards are the solicitation and application materials are aspirationally looking to be posted by October 24th on Organ Buys. So all applications will occur through the Organ Buys process on the website. So I have a slide on that a little bit later here. But the request for grant applications are slated typically, again, possibly or potentially to be posted by the 24th. We will keep folks apprised of that deadline. And then the application deadline will be due approximately 30 days from that post to Organ Buys. And we're looking at between the end of October and mid-December, mid-November to mid-December for application review and evaluation by our internal grant review committee, and awards being dispersed just after the new year. They're going into January and to February. And so notice of awards will be posted to Organ Buys and emailed to all applicants, hopefully just after the turn of the new year, with anticipated fund distribution and initial start dates of projects slated for February. And again, we will make every effort to be transparent and up to date about these deadlines. We are beholden to a lot of processes internally in terms of getting all of our ducks in a row here at OHA in terms of the many parts that it takes to be able to successfully roll out. And the subsequent informational sessions that we have will likely parallel with a lot of these different processes. So we'll be talking about contracting, we'll be talking about what that looks like in the subsequent informational sessions. Next slide, please. And in terms of application scoring priorities, this really goes back to some of those aspects that I identified within the OHA strategic plan about ensuring that the funding that is allocated really is earmarked toward agencies that are aligned with that priority of eliminating health inequities by 2030. And so priority will be, of course, given to those organizations or those entities that deliver services to identified service populations. And those service populations, which have been really highlighted or centered for this grant funding, include child, youth, and family serving organizations or practices, including school-based services, adolescent and early childhood, organizations serving individuals involved in the criminal justice system, organizations that, of course, operate mobile crisis intervention or mobile response services, those rural and frontier communities that we identified in one of the very first slides, given those intensive provider shortages within those areas. And so priority points will be automatically assigned based off of locations using the Office of Rural Health or OHR or ORH zip code-based primary care service areas or PCSAs. As identified earlier, organizations that provide office-based medication-assisted treatment or MAT services. Priority will also be given to entities that prioritize eligible educational incentives that provide services to communities who are traditionally marginalized or underserved, and providers who, of course, deliver culturally and linguistically specific behavioral health services. And just to provide a couple definitions here, communities who are underserved include but are not limited to communities of color, tribal communities, LGBTQIA2S plus communities, refugee or immigrant communities. This could also be inclusive of veterans, persons with identified disabilities, individuals with intellectual and developmental disabilities, individuals with limited English proficiency, incarcerated individuals or incapacitated individuals as a result of contact with the criminal legal system, and of course, rural residents. So communities who are underserved are identified within the bill. When we talk about culturally and linguistically specific services, this is, of course, identified as providing quality mental health, substance use, in problem gambling, or other behavioral health prevention, treatment, and recovery supports and services that are designed specifically for a distinct minoritized cultural community, developed based on the languages used and cultural values of those distinct communities, and also designed to elevate voices and experiences that really have the aim of enhancing emotional safety, belonging, and shared collective cultural experience for healing and recovery amongst the distinct cultural communities served. And so these definitions are also provided in within the language of the bill, and we will also make those available as well too. Next slide, please. And in terms of funding guidelines or award amounts, this slide demonstrates the maximum award amount that's based on the total number of staff employed by said organizations. So small organizations have been identified those as having less than 75 employees, and those award amounts will be capped out at 150,000. Medium organizations sized at 75 to 125 employees capped at 180,000 for the grant. And those large organizations identified as consisting of 126 plus employees at $225,000. Organizations, of course, that are awarded may not receive all the funds they have requested. This is, of course, subject to clearly laid out, or at least to the extent possible, identified implementation plan for said funds and budget narratives, which we will be discussing a little bit down the road in our other informational webinars that are to follow. Next slide, please. We will be discussing a lot more in-depth things like the submission and selection process in our subsequent informational webinars. But just as a quick snapshot or overview here, upon the request for grant applications closing, the single point of contact, or SPC, which will be identified a little bit later here in the webinar, will perform an initial administrative pass or review of all applications received by the submission deadline. Just looking at basics like the completeness of the application and that all requested materials are included in said application. The grant review committee will then review each application independently, and of course will excuse themselves from the review process if there is any existing conflict of interest. All reviewers sign, of course, a stated conflict of interest form. And reviewers will, of course, document their review of each application using a pre-identified scoring rubric and criteria, which are identified and made readily available to grant applicants. The grant review committee then, after that conclusive review of all individual applications, will come together to discuss applications and finalize the justification and recommendations for grant awards. So again, hopefully, ambitiously, this process will be completed prior to the new year so that all funds and grant awardees can be notified by the new year, and subsequent funds distributed after the new year begins. Next slide, please. And although our application has not yet opened, we encourage folks to get a jump start on the application process by visiting the Organ Buys website, through which all application materials solicitation will be received. And so here is a hyperlink to the Organ Buys website. Again, even though it's not open yet in terms of the solicitation posted, you are certainly welcome to register and begin that process. Next slide, please. And in that process, it's a little bit counterintuitive, but hopefully this large red arrow here demonstrating where to go on the actual website. You will need to register in Organ Buys by actually clicking on the supplier registration tab, which is a little bit counterintuitive given that you all are not suppliers, but that you all are applicants to the grant. But you will want to register your organization and your information if you are not already in the system by clicking on that supplier registration tab. And given that Organ Buys is run through an independent vendor, if you do experience any technical issues, please feel free to call their help desk at 855-800-5046. You can also leave an email on said number to provide support or to receive support. OHA cannot provide technical assistance with Organ Buys since it is technically since it is an outside vendor, but they do have an independent help desk system available through Organ Buys if you experience any challenges in the registration process. And of course, there is information that's relevant to HB 2024 internally here at OHA, which I'll provide at the very end. I had mentioned a specific point of contact as well as a inbox that we have for House Bill 2024 and any questions you might have. I do see a lot of questions here in the chat that we are going to now pivot to in the Q&A. If we do not have an answer for you today, we can definitely get said answer. And what we are going to do is compile all of these questions that we cover today on this webinar and put them into written format and make these available. So any question and all questions are greatly appreciated. So now as we enter the question and answer period, rely on my amazing colleagues here at OOHA, and now I can open up the chat here and look over some of these items. I will open the floor to any questions. And after we end the Q&A period, I will, of course, give the information for the specific point of contact here at OHA for the grant, as well as information relevant to the HB 2024 website. So enough of me talking already. I will now stop and scan or at least open the floor for any questions, and also look over the chat here if any questions that have not yet been fielded.
Are we raising our hand or just going in on it?
Sure, David, go for it.
Great, thanks. What was the total amount allocated by the legislature for this bill?
We have $3.7 million to distribute.
Okay, and then do CADCRs, are they applicable?
They are, yeah.
And for follow-up purposes, rather than going through this whole thing, a seminar again, will there be some links sent for the application process, or should I just re-watch this?
Yeah, we'll definitely make sure that we keep our website updated as best we can, especially when we're able to post a solicitation to Oregon Buy. So definitely hold on to that website, and we should have most updates there. And then you can also just email us at our central inbox, our HB 2024 inbox. We'll be able to answer questions there as well and keep folks up to date.
Excellent. And lastly, big undertaking, OHA, understaffed, overworked. Appreciate all you guys very much.
Right back at you. Thanks so much.
Yeah, I can jump in. Yeah, first of all, appreciate what you guys are doing. So beneficial. My question might be a little bit off topic, but since you guys are so well informed and I'm trying to get up to speed, on contributing and doing, our part in resolving these mental health issues in Oregon. One of the challenges that we run into is, we have to compensate our therapists so they're not burning out. And we need to compensate our therapists so people want to get into this field, right? They don't hear horror stories about low pay and burnout from their colleagues. We've created a compensation plan at Allied Counseling that compensates therapists very well, but it means our margins overall are very small. So I'm wondering if you guys can point me in any direction toward grant money, resources that can help a practice like ours grow. Like, for instance, like we want to put in a play therapy center. There's a space available in our building, but to come up with that kind of capital, which could lead to like this initiative, like the hiring and recruiting and stipends and all that kind of stuff. But we have to grow before we can add more headcount to our practice. So can you point in the direction of where we can learn more about more programs like these that your OHA is offering?
So much, Brett, and I will definitely name sort of the elephant in the room that we are under, especially in the state of Oregon, the situation right now where funding is being, we're looking at funding cuts, and we're having to prioritize a lot of different initiatives, not only like recruitment, but also retention of behavioral health workforce providers. And we're actually on this OHA team a part of a broader work group for House Bill 2235, which was the sort of big incentive package that was passed a couple of years back. We're concluding that work right now, and we have a report that's coming out very soon. I think it's due to the legislature in December of 2025. But one of the recommendations that's passed by the work group is to look at exactly like what you're talking about. Like, so if we are seeing a decrease in funding overall, what are some small grant opportunities? What are some additional opportunities to sort of supplement and augment that funding? And one of our recommendations from that work group, which just passed, was to um, convene, a work group, and also to convene a place to compile all those resources and to make those readily transparent and available so folks know where they are and sort of how to apply to them. So even though I don't have a ready answer for that right now, there is something forthcoming that will be recommended by our work group that will at least lead folks in the right direction who are interested. So that's just one thing that we're doing in HB 2235. And I believe there are other hopefully programs that are outside of behavioral health workforce incentives by other OHA divisions that are currently making funding available, which we can compile as well too and share with you all.
Okay, sorry to go a little off topic. Like I said, I got you guys here and I had to pick your brains because I got to get informed, about how to participate in this process more, because these are noble goals for 2030. Appreciate what you guys are doing.
Thank you, Brett. And again, there are no off-topic questions in this room. It's we are all tackling this workforce shortage in many, many different areas, and so I think that addressing this and providing funding through these educational incentives are just one path to ultimately trying to tackle this problem.
Hey,
Yeah.
one more question. One more question. Is there these fundings are available for for-profit centers, correct? Or is it nonprofit?
Yeah, I did. Yeah, I was just responding to your question in the chat, David. But yeah, I'll just talk. I think it's easier to explain this rather than typing, so I'm glad you said it out loud. Yes, so the for-profit or nonprofit is not really a distinction within the eligibility criteria. There's really nothing about that. It's really there's a different set of eligibility criteria that's a little bit more complicated, but at the very, it's mostly based on organizations that eligibility is based on organizations that have a certificate of approval to provide behavioral health services. So that's where one of the main distinctions is. And then after that, there's a set of other criteria that says at least 50% or more Medicaid, uninsured, or Medicare. And then there's a couple other pieces within that, but I think those are the biggest ones that it's focused on. So, no real distinction between for-profit or nonprofit.
Excellent. Thank you.
Mm-hmm. Yeah.
Hey, Tim, it's Juliana.
Hi there.
Excited to see this. I asked a question in the chat. To address the tax and income issue, is it acceptable to partner directly with schools, training programs, and other entities to route the scholarship money through them instead of the employer?
Yeah, so sorry, can you repeat your question again?
Okay, you bring up a really good point, and I feel like I understand the issue. So when we provide scholarship money, you flagged the tax issues, right? Could be considered income.
Right.
But when you partner with an outside entity, like a community college, a training program, so that the money is in partnership with the COA, the organization, and the entity, that helps to not have it be taxed so that the behavioral health staff get the full benefit. Is that acceptable in the application?
Yeah, absolutely. Actually, the partnership is something that we encourage quite a lot, and we were actually hoping to have some educational institutions with us today to meet with folks, sort of like as a meet and greet, but they weren't able to come. But yeah, so that's a great question, and I think that is a good approach, and worth exploring there. Thank you, Juliana.
Thank you, Tim.
Yeah, so I think we've got a little bit of a mix up. We've got we've got hands up and then we've got questions in the chat. So I think I will go ahead and run through the questions in the chat really quick. And then, but keep your hands up. Sorry, I saw you. I didn't mean for you to put your hands down, and I will get to you all unless your questions are in the chat. So let me kind of go through here. See, make sure I don't miss anything. Okay, can you define integrated peer supports? Does that mean we directly hire people for peer supports and they are on staff currently? Yes. So in that definition, it's a little complicated because it does indicate that team-based care is this or this. So it's got a number one and a number two. And then under the number two, it does say certificate approval and then something else. And then it says like the any combination of these things. Integrated peer supports is one of those. And I see the next question from Ambrosia says similar question for psychiatric providers. So I'll try to address both of those in one go. So yes, that is what integrated supports means. Psychiatric providers is another thing on there, but it says any combination. So any combination, which means two or more of those four criteria. So hopefully that helps answer that question. Philip, I saw you had your hand up. Does that help, or is there um, uh, if I could explain it better, let me know. Okay. Ambrosia, does that answer your question as well?
Yes, I think it was list A or B, and then I think you were talking about under B when it came to eligibility. And so
Right.
two or more, that's what I missed, two or more. Thank you.
Yeah, no problem.
So I have, while I have your attention, I put another question in. Are there any organizations that are too small to qualify? Because you define small as less than 75. So
Yeah. No, there's no minimum like for that on there. So no, so answer question is no.
thank you.
Yeah. And even though I answered some of these in the chat, I'll just also go through them too. Would stipends include things like paid internship programs? Yes, they would. CADCRs do qualify. I think Brett already graciously answered that one. What qualifies as acute behavioral health needs? That's a fantastic question and something that is not currently defined in rule. But for this grant, it's being coupled with those individuals that are involved with team-based care. So I know that that's not a perfect definition, and that's really tough, but we're really, unfortunately, in a position where these monies are based on a lot of educational things, and we're trying to get the money out the door as quickly as possible. And being able to define these things and rules takes even more time before we can even get these monies ready. So what we are doing is coupling acute care with the definition. So reading the definition, you will see some, and I'll make sure that this is spelled out better in our FAQ document that comes out later after this. But essentially, make sure to read that definition and see sort of like what is around acute care in that definition, and that should help explain like sort of the intent of what we're getting to. And like I said, we'll attempt to explain that more straightforwardly in the FAQ document that comes out. So really appreciate that. Heather, I see your hand up, and I'll go ahead and pause on the chat questions and see what you have for us.
Oh, sorry, my question is in the chat.
Oh.
It was under another question. So just a clarification. In some programs that we've helped administer, the stipend is you are allowed to ask the individual receiving the stipend to use part of their stipend for an outside supervisor when there's not an internal supervisor available to pay that outside supervisor's fee. Is that an allowable activity in this structure?
Yeah, absolutely. Mm-hmm. Yeah, I think the main thing that the legislation language is that they are a graduate in a graduate program. So, if that is a part of what they use their stipend for, then that works.
And then just there's a little weird operational thing there. is there a way to do that for an internal supervisor, or would you have to hire an outside contracted supervisor? Because the internal supervisor might be considered admin. I don't know. So just a clarification on that. That's a little weird operational problem with some of these programs.
Yeah. I don't believe that the internal supervisor would be considered admin, but I'll definitely we'll record that question on the FAQ. That's a really interesting one. But right now I'll say without much investigation, I will say that no, I don't think they would be considered admin, but
Yeah, it was a weird one to run into. It's like, really, we could pay for an outside supervisor, but not an existing employed internal supervisor. And we've actually run into that in administering some similar programs. So just some clarity on that one would be helpful.
sure.
Thank you.
Perfect. Yeah. Awesome. Yeah, we'll make sure to clear that up as best we can with our proceeding document. So
Sorry, because it has to do with what Heather just asked. Um,
yeah.
to can reiterate, so as it's worded right now, you can pay for supervision with this.
No, this isn't for clinical supervision directly. So if you've got a graduate student and they are getting a stipend, from my understanding of the question, that if you've got a graduate student who needs clinical supervision, yeah, that they are receiving a stipend, that they would be able to use part of that stipend to pay for their clinical supervision.
Okay, so if they get the stipend, then they can pay.
Yes.
Got it.
And as part of the program, you can say, you will have to do this out. We have this outside person you can contract with. So this is where it gets a little wonky. Sorry, I'm asking a weedy question, but it is something that we've run into that's it just is a little strange and awkward, because why would you hire an outside person if there's an internal person? But if you can't pay for the internal person, then you have to hire the external person to be available for this. Yeah, you get what I'm saying. So just clarity on that question. Yeah, it's weedy. Sorry.
Yeah.
But it does come up. I don't think it's intentional when people structure these, but that's kind of it happens. Thank you.
Yeah, absolutely. Okay. Yeah, thank you. And Shara, I saw you poke your hand up for a second. Was there anything
It
that
was
you
the
had really
same.
quick?
Melinda and Heather covered it. Thanks, Tim.
Okay, awesome. All righty. So I'll go back to the chats. So next question is, does psychiatrist on staff mean one that is prescribing, seeing clients, or is one that is providing consultation to staff and some assessments of clients sufficient? So it's going to be psychiatric services being provided directly to clients. It's not going to be consultation for other staff. It's going to be services provided directly to patients or clients. Can you define outpatient facility? So we do have a definition for that. So in our FAQ document, that'll be more direct. I don't have the official rule definition out in front of me, but essentially it is a treatment or intervention that occurs in an outpatient basis, like not in a residential facility, one that is a person can leave, that they're not going overnight. They're receiving it in one day, and it's within that sort of office setting. But we'll define that better for the FAQ. And are we limited to one application per organization? Yes, unfortunately. And will there be a follow-up email with these timelines and links to the application? Yes, there will be. And then also please sign up for updates in our webpage. I did post that in the chat a little bit lower down. So you can sign up for updates on our main webpage, which is in the top right corner, and we'll make sure to send that information through that as well. What is the grant funding period? 1 year, 2 years? So at this point, it's when we can get the money out as fast as we can, and all the way until June 30th, 2027. And I do realize, and totally understandably, that that is not a lot of time. It's a year and a half at the most when the contracts will actually be done. So I do realize that that's not a lot of time, and especially when we're thinking about some of these incentives being related to like academic calendars and things like that. So that's something to consider. There was a question a little bit farther down in the chat that asked about CEUs and other training programs and stuff like that. So I think that's another thing that we're going to try to do is take a look at and maybe as like sort of a way to assist people in thinking about when they're applying for this grant, have a list of training programs that are, yes, some of them academic, more traditional, for lack of a better term, that follow that traditional academic calendar. And then also training programs that are a little bit different, that follow a different set that uh, people can get sort of an idea of. But yeah, 6/30/2027 is when the cutoff would be. All right. Clarify when funds are used within an internship. Oh, sorry. Yeah, that was the question, I think, from Heather. So does that mean we've got one that asked, does that mean a small organization would receive $150,000 per year or $150,000 total over the 2-year grant period? So that would be over the entire grant period. In that example, 150,000. And we did put the link to Oregon Buys in the chat. And then Brett did a great job of answering this question, but I'll go ahead and say it out loud. So it's kind of related to what I was talking about just a minute ago. Can the funding be utilized for professional development and continuing education? So Brett answered, we can support professional development and CEUs that lead to a certification or credential that leads to increased behavioral health services for the communities you serve. So yeah, that was a great answer. We are looking at, so it's something that does lead to an educational like goal, right? So that's really the intent of it right there. We will have a better explanation probably in our FAQ, so please stay tuned to that. Does it help pay for clinical supervision for behavioral health staff going towards licensure? So unfortunately, it does not directly pay for clinical supervision, but my answer in the chat, I did indicate that funds could be used for loan repayment or loan forgiveness for supervisees that are already that I've already passed. They're not like looking to just go back into education, an educational program because they just graduated, right? And they're getting their clinical supervision. They are eligible to receive eligible to receive loan repayment or loan forgiveness through their employer through this grant. Yeah, how much integration of team-based care would make one eligible? Brett answered, if your organization provides any level of team-based care, you will be eligible. So like I said, that definition that we have, there's a combination of at least 2 under that list under B. And we'll make sure to list that out very directly in the FAQ again. Then will the presentation or deck be shared? Yes, we will make sure to post it on our webpage, and we'll hopefully have that posted by the end of the week. Let's see, we have another question. Is this separate from the 10% QDP above DMAP from team-based high acuity Medicaid providers that we've heard about from the CCOs, or is this how that would be dispersed? This is separate from all of that. This is just this is a completely separate grant program and grant process. So it is not related to that. And then we have a question from Raquel. For example, if an agency is seeing, then referring out those living with addiction, but is also seeing high needs marginalized communities, would that qualify? Um, yeah, I think that question that would not disqualify someone from the grant. I think it really comes down to the eligibility requirements that indicate the team-based care in that definition. So the combination of psychiatric services, integrated team-based care, um, and then what follows that definition right there. So here, I can even pull it up really quick on my end. I did have it up and then it got behind trying to answer other questions. I apologize. So the combination, so the criteria, if you're not a CMHP, is that the organization needs to hold a certificate of approval from OHA to provide behavioral health, drive at least 50% of annual behavioral health revenue from services to OHP members. And then we're also considering uninsured and Medicare also. And then provide integrated team-based care that includes any combination of on-staff psychiatric provider, integrated peer support, case management services, and individual, family, group, and community-based services as clinically indicated. And we have the general inbox in the chat. Shira asked, I am assuming we have the freedom to require post-degree completion work requirements with these dollars. Yes, as long as the curriculum/post work is required for degree completion. And we already answered Philip's other question. Is a paid internship for a master's level behavioral health student completing a required 6-month internship considered to be a stipend? And Brett answered, that's a great question, Maggie. Yes, I believe we can consider this. However, we'll staff this and post our final answer to this in our Q&A. So our FAQ document that we will post. So yes, appreciate that, Maggie. We'll get back to you on that one. Let's see. So we've got a question from Megan. It seems like counties will be penalized if their admin office is located in an urban zip code, yet serves individuals in the rural communities. Is a way to show that we serve rural communities in our application. So, well, first of all, we will not penalize anybody through this. It's just a way to prioritize organizations that do provide services directly in rural areas. So there's no penalization happening. We do have a answer from Brett here that we'll have entities post their site zip code. So as long as you indicate where your primary site is and the site you're applying for receiving incentives, that site will get priority if in a rural frontier designated area. Certainly understand where that question is coming from, and something that does need to be addressed with the language in the bill and the intent of this bill. There is unfortunately that kind of cutoff that they've indicated with that. All right. And then, yes, so Aaron, you asked, I think it would help if you explained what the certificate of approval is. And yes, there is a whole lot of information when it comes to that. So if you have a certificate of approval, you definitely know you have one. I'll just say that. And Kalani definitely did a great job of providing some information there to look up the different certificates of approvals there for behavioral health. We will also have that in our FAQ document and maybe try to spell it out a little bit further too, just to help. All right, yes, slides will be posted. We have the acute behavioral health, already addressed that we're going to work on that. Okay, Juliana, we did answer that out loud. Presentation mentions funding for licensed professionals, but then also stating it's for graduate students. Is the funding specifically for students, or can it be for fully licensed individuals as well? And Brett answered both, as long as the education leads to a degree, certification, or credential. Oh, I'm sorry. Certification or credential that gives the individual the ability to provide behavioral health services. We've got a lot going on down here. So I think the questions are growing and we do have answers to a lot of these. So I think what I'm going to do is I'm going to see what questions don't have answers yet. And I will address those. Thank you, Ambrosia, for answering Karen's question. Okay, Annette asked, is paying an intern who is still in school and only contracted with the agency count as stipend funding? Yes, that can be counted as stipend funding. Yeah, that was a good question, Jesus. We will look into that for you. Yeah, I already kind of have some ideas in my head how we could manage that, but I think I want to talk with some of our people back here at OHA before we get that answer. So we'll make sure to have that in the Q&A. Okay, Maggie asked, does scholarship/tuition support for undergraduate programs have to be for an undergrad program that results in some sort of behavioral health certification? So, yes, it does have to be result in a behavioral health certification or be a requirement of a behavioral health certification or license. Yeah, so the question of so Shira asked, what about licensure/credentialing fees? Brett answered, I think we should be able to allow stipends to cover those fees. And then Melinda, does this include renewal fees? And Brett said yes. So again, that it can be covered under the general guise of stipend. So that's I think we've discovered that might be a good way to really think about this in that it could be covered under stipends for, to be paid by the individual. So I think that's the thing, maybe a good strategy with that. Really, the reason why we're kind of thinking of it in those terms is because it's really the language of the bill. It's very, sort of closed off into the four things that these funds can be used for by grantees: the loan repayment or loan forgiveness, graduate stipends, scholarships for undergrad and graduate degrees, and what am I missing, Brett?
Did you say tuition assistance?
Tuition assistance. That's the one. Yep.
Yep. Yeah, and also we want to hold space too for stipends to be used however the individual wants to use them. And so I think the direction there would be, yes, here's your stipend. You can use this for your licensing and credentialing fees. However, we also want to have that ability for the individual to use that towards things that they might need that are even more pressing. Housing, things of that nature, food, whatever it might be. But that's I believe how we want to kind of focus our attention on stipends is a freedom and flexibility for the individual to use it based on their own personal needs.
Right. Can it pay for specialty certifications like play therapy? Yes, certainly. Yes, so April's asking for the link to Oregon Buys again. I can do that right now. And go ahead, Shira.
Thanks. It's just easier to say than it is type. I like the idea of the stipends because it allows for more freedom of use. And I heard you say, I think Tim or Kalani, that like if someone had just completed an educational program, that they still qualify for these funds. But is that only specific to like loan repayment, or can I be giving stipends to, I mean, it just seems kind of, that could be really broad, right? Like all of my providers have completed education at some at some point, and so can I give them all stipends to pay for their licensure and renewal fees under, like, just more specificity around how the stipends can be used, I think would be helpful.
Yeah, absolutely. So, because the language in the bill does say graduate stipends, they do need to be involved in a graduate program. So
Oh,
somebody can be licensed and still be in a graduate program. They just have already created, like, finished another one, right? I think that, there's several people that, go on to become psychologists that are LPCs and things like that. But so that's one way that I think, we find some blending in there. But if we're talking about like maybe the more traditional track that we're thinking about, like somebody, finishes grad school and they're not involved in any education program, including any specialty certification program, then really the only funding that would be eligible to them at that point would be the loan repayment or loan forgiveness, from my understanding.
okay, thank you.
Hmm. Yeah, go ahead, Melinda.
I was just going to ask, can you go back to the slides where it mentioned what is allowed? Um, okay. So this is like the main categories.
Yeah.
Okay. And can you go to the next one? Dude. Perfect. Is there a few more? All right.
Yeah, this is what they may not be used for.
All right. Can you go back one more again? Thank you. And those are the main ones. Okay. Thank you. That was all.
Great. Let me make sure I didn't lose my place here in the chat. Okay, looks like we answered that question from Rosanna. I have another question from Philip. The incentive for paying tuition reimbursement for anyone pursuing behavioral health higher education only for the funding period and not before. If someone started their education several months prior to the grant, would their tuition qualify for reimbursement for that period, or only be the percentage of the terms? Yeah, so that would be eligible. So yeah, if they're involved in that, it can be used for things that they're in, if it's the same program that they've been in and it's for their certification or license or whatever they're pursuing, or as a requirement of one of those, then yes, that can be eligible. Yes, thank you, Kalani. Art therapy does qualify. No, it does not require how long you have had the COA. Thank you, Shira. Someone share info on how to become contracted with OYA. Ambrosia, can you put your email in the chat and we can connect you with our contacts at OYA. And then we will put that, and then we'll ask them what the best way to get in contact with OYA is, and we'll put that on the FAQ. We'll put, if they have a journal inbox or whatever, we'll put that in there. So awesome, I appreciate that. We'll make sure to connect you and anybody else that's interested. We will have. Oh well, maybe Kalani found it for us. So very nice. All right. So it looks like I reached the end of the chat questions. This has been wonderful. Before we go, is there any other questions that you have that anybody has for this grant or these funds?
Hey, just thank you guys again for the time and energy and all the work you guys do. It doesn't go unnoticed. Appreciate you.
Yeah, really, I appreciate that, David. And yeah, if anybody's interested, and even if you are a part of this webinar and you feel that your organization doesn't qualify, at the very least, go to our main webpage and sign up for updates. There's we do share out other opportunities that come out from sometimes other organizations, but other OHA offices that might be relevant to your practice. And then we also may have some new legislation that comes through that does provide, funding for different entities that might not be eligible for this specific grant. So yeah, make sure to go to our webpage, and I posted that a few times, but I will do it one more time here in the chat so you can bookmark that and sign up for updates. It's in the top right of our webpage where it says keep informed. There we go. Here's the link to our page. So we'll just stay on for another few seconds, 30 seconds or so, just so people can click that link if they need to. But thank you everyone for everything. I hope you all have a great day and a great weekend. And thank you so much that you do for our communities here in Oregon.
Well, while I have you on here, I no one's asking questions. For this, with the behavioral health I'm assuming it's pretty broad. Would this also include like psychiatric med providers, or does this exclude them?
And you mean like to receive the incentives?
Hmm.
Yes, they would be able to receive these incentives. So, definitely loan repayment if they're already done with their program, if they are in, coming in and providing direct services, that's definitely something that would be, I don't know how much they would be involved with more training after they become a psychiatrist, but it's possible. So, those other funds could be used for them, but definitely loan repayment to help incentivize their retention.
Okay, cool.
Perfect. Well, thank you, everyone. I hope you'll, like I said, have a good one. And yeah, be in touch with us, and we will have these things posted and updated as soon as possible. Have a good one.